After the age of 60, many changes in the body are labeled as normal aging. Feeling a little more tired, feeling a little dizzy sometimes, feeling short of breath more easily. Because these changes are common, they are often ignored. People say, "This is just part of getting older." Doctors sometimes say, "This is expected at your age." But common does not always mean harmless. Some symptoms feel normal only because they develop slowly. They do not cause pain. They do not stop daily life immediately. That is what makes them dangerous. The goal of this video is not to scare you. The goal is to help you recognize patterns early. Early awareness gives you options. Late awareness creates emergencies. In this video, we will talk about 5 symptoms that many people over 60 experience. Most people dismiss them, but these symptoms should never be ignored. Each symptom is explained calmly. You will learn why it happens. You will learn when it matters. And you will learn what to watch for. Let's begin. Many people over the age of 60 experience a strange sensation in the morning that they struggle to describe clearly. It is not pain. It is not spinning. It is not weakness in the way people imagine weakness. Instead, it is a brief sense of lightheadedness, a moment where the body feels unsteady, or a feeling that the head is slightly heavier than usual. This sensation often appears when getting out of bed or standing up for the first time in the morning, and because it usually fades within seconds, most people quickly dismiss it. They say to themselves that they simply stood up too fast, or that they did not sleep well, or that this must be what getting older feels like. Because the feeling passes, it feels safe to ignore. But after the age of 60, morning dizziness is rarely meaningless. It is often the body quietly communicating that the system responsible for controlling blood flow to the brain is under strain. To understand why this happens, it is important to understand what the body is doing during the transition from lying down to standing. When you are lying in bed, your body is in a horizontal position. Many people over the age of 60 live with a constant sense of tiredness that they find difficult to explain. It is not the kind of tiredness that comes after hard physical work. And it is not the kind that disappears after a good night's sleep. Instead, it is a low, persistent fatigue that seems to follow them throughout the day, even when they are doing very little. Because this fatigue develops slowly, most people accept it as a normal part of aging and stop questioning it. Often, these individuals do the right thing and see a doctor. Blood tests are ordered. Basic heart tests may be performed. The results come back within normal ranges. They are told that everything looks fine. While this reassurance may feel comforting at first, it can also be deeply frustrating because the fatigue remains. Over time, many people over the age of 60 notice unusual sensations in their chest that are difficult to describe clearly. It may feel like a flutter, a brief pause, a skipped beat, or a sudden moment where the heart feels as though it is beating faster or harder than normal. These sensations often come without warning, last only a short time, and then disappear. Because they do not stay, most people convince themselves that they are harmless. People often say that if something serious were happening, it would not stop on its own. They believe that danger must be constant or dramatic. When the sensation fades, they feel reassured and move on. Over time, they may experience these sensations repeatedly, but still avoid mentioning them, especially if they are brief and not painful. This is one of the main reasons irregular heart rhythms are often missed in older adults. After 60, the electrical system of the heart becomes more sensitive and less predictable. The heart does not only pump blood, it also relies on carefully timed electrical signals to maintain a steady rhythm. As the heart ages, these signals can become slightly disorganized. Small areas of the heart muscle may fire too early, too late, or out of sequence. When this happens, the rhythm may feel irregular, even if the heart rate itself is not very fast. These irregular sensations are often intermittent. They appear for seconds or minutes and then stop. This pattern makes them easy to dismiss, but it also makes them more concerning. Many important heart rhythm conditions, including atrial fibrillation, do not occur continuously in their early stages. They come and go. During periods of normal rhythm, the heart may feel completely fine, and standard tests may show no abnormalities. Because of this, people often assume that if an electrocardiogram looks normal, there is nothing to worry about. In reality, a normal test only captures what is happening at that specific moment. It does not rule out rhythm problems that occur intermittently. This is why symptoms matter, even when tests appear reassuring. Irregular heart rhythms can affect the body in subtle ways long before they cause obvious problems. When the heart rhythm is irregular, blood flow can become less efficient. The heart may not fill or empty as effectively, which reduces the amount of blood reaching the brain and other organs. This can contribute to fatigue, lightheadedness, shortness of breath, or a vague sense of weakness that is difficult to explain. One of the most serious concerns with certain irregular rhythms is the increased risk of blood clots and stroke. When the heart does not beat in a coordinated way, blood can pool in parts of the heart. Over time, this pooling can lead to clot formation. If a clot travels to the brain, it can cause a stroke. Importantly, this risk exists even if the irregular rhythm is not felt all the time. Many people assume that if they do not feel severe symptoms, they are safe. Unfortunately, irregular heart rhythms can be silent. Some people feel them clearly, others barely notice them. The absence of strong symptoms does not equal the absence of risk. This is why intermittent heart sensations should never be ignored simply because they are brief. Certain factors make irregular heart sensations more likely after 60. These include high blood pressure, heart disease, diabetes, sleep problems, dehydration, and the use of certain medications. Caffeine, alcohol, and stress can also trigger or worsen rhythm disturbances, especially in a heart that is already more sensitive due to age-related changes. Irregular heart sensations deserve attention if they happen repeatedly, if they feel new or different from what you have experienced before, or if they are accompanied by dizziness, shortness of breath, chest discomfort, or fatigue. They also deserve attention if they occur more frequently over time or begin to last longer than they used to. It is important to approach this topic calmly. Feeling a skipped beat does not mean you are in immediate danger. Many irregular beats are benign. The goal is not fear. The goal is recognition. Noticing patterns and reporting them accurately allows healthcare providers to decide whether further monitoring or testing is needed. Modern medicine offers many ways to evaluate intermittent heart rhythms. Longer-term monitors can capture rhythms over days or weeks, increasing the chance of detecting problems that short tests may miss. When identified early, many rhythm issues can be managed effectively, reducing the risk of complications and improving quality of life. Ignoring irregular heart sensations removes the opportunity for early intervention. Paying attention preserves it. After 60, the heart often gives subtle signals before serious problems develop. Learning to listen to those signals without panic is one of the most important skills for protecting long-term health. Irregular heart sensations that come and go are not something to fear, but they are something to respect. They are reminders that the heart's rhythm matters just as much as its strength, and that awareness today can prevent serious events tomorrow. Many people over the age of 60 notice that everyday activities begin to feel more demanding than they used to, even when those activities are not physically intense. Walking a short distance, climbing a few steps, carrying light groceries, or talking while moving may suddenly feel more difficult. The breath feels shorter. The body feels heavier. Because these changes develop gradually, most people adapt without realizing what is happening. They walk more slowly. They pause more often. They avoid stairs or hills. Over time, these adjustments become routine, and the shortness of breath is accepted as a normal part of aging. Because there is no sharp pain and no dramatic event, it feels safe to ignore. However, after 60, shortness of breath with mild activity is often an early sign that the heart and circulation are under increased strain. Breathing and circulation are closely connected. When you move, your muscles require more oxygen. To meet this demand, the heart must pump more blood, and the lungs must supply more oxygen. In a healthy system, this increase happens smoothly, and breathing adjusts naturally. After 60, the heart may still respond, but its ability to increase output efficiently may be reduced. One reason for this is reduced cardiac reserve. Cardiac reserve refers to how much the heart can increase its performance when needed. As we age, this reserve gradually decreases. The heart may be strong enough for rest and light activity, But when demand rises even slightly, it must work harder to keep up. This extra effort can be felt as breathlessness, even during tasks that once felt easy. Blood vessels also play an important role. With age, blood vessels become stiffer and less responsive. This affects how efficiently blood is delivered to working muscles. When muscles do not receive oxygen as efficiently, the body compensates by increasing breathing. This creates the sensation of shortness of breath, even when lung function itself is normal. Another factor is fluid balance. Many older adults experience subtle fluid shifts in the body. Fluid may accumulate slightly in the lungs or tissues, especially in people with high blood pressure, heart disease, or certain medication regimens. Even small amounts of excess fluid can reduce how effectively oxygen is exchanged in the lungs, contributing to breathlessness during activity. Because these changes are gradual, people often underestimate their significance. They compare themselves to others their age and assume everyone feels the same way. They may say, "I'm just out of shape," or "I'm getting older." While fitness does influence breathing, unexplained shortness of breath should never be attributed solely to aging without consideration. Shortness of breath becomes more concerning when it appears with activities that previously caused no difficulty, when it limits daily movement, or when it is accompanied by fatigue, dizziness, chest pressure, or swelling in the legs or ankles. These combinations suggest that the heart may be struggling to meet the body's demands. It is also important to recognize that heart-related shortness of breath does not always come with chest pain. Many people expect heart problems to be painful. In reality, especially in older adults, heart strain often presents as reduced stamina or breathlessness rather than pain. This misconception leads many people to delay evaluation because they do not feel what they believe a heart problem should feel like. Shortness of breath can also have multiple contributing factors. Lung conditions, anemia, deconditioning, and anxiety can all play a role. However, the presence of multiple possible causes does not mean the symptom should be ignored. It means the symptom deserves thoughtful evaluation to determine what is contributing most significantly. The key message is calm awareness. Feeling winded once is not alarming. Feeling consistently limited by mild activity is a signal. It is the body's way of saying that the balance between oxygen demand and supply is shifting. The encouraging news is that early recognition of this symptom can make a significant difference. When shortness of breath is addressed early, before severe limitation develops, interventions are often simpler and more effective. Adjustments in medication, activity pacing, hydration, and treatment of underlying conditions can improve breathing and energy. Ignoring shortness of breath allows gradual decline to continue unnoticed. Paying attention allows timely support. After 60, maintaining the ability to move comfortably is essential for independence, confidence, and quality of life. Shortness of breath with mild activity is not something to fear, but it is something to respect. It is a reminder that the heart and circulation deserve attention, even when symptoms feel subtle. Listening to this signal early can help preserve mobility and prevent more serious problems later. Many people over the age of 60 describe a change in how their mind feels, even though they struggle to explain it clearly. They may say they feel foggy, slow, or slightly disconnected. Others describe a sense of pressure in the head, especially in the morning or during periods of fatigue. Because these sensations are subtle and not painful, they are often dismissed as normal aging or stress. Brain fog after 60 rarely arrives suddenly. It develops gradually. Concentration becomes more difficult. Mental tasks require more effort. Multitasking feels overwhelming. Words may come more slowly. Because these changes are mild at first, people adapt. They write more notes. They avoid mentally demanding tasks. Over time, this adaptation hides the underlying problem. One important reason brain fog appears after 60 is changes in blood flow regulation to the brain. The brain requires a steady, well-controlled supply of oxygen and nutrients. Even small fluctuations in circulation can affect clarity, focus, and processing speed. After 60, the systems that regulate blood flow become less responsive, making the brain more sensitive to changes in blood pressure and heart rhythm. Morning brain fog is especially common. During sleep, blood pressure drops slightly, and the body is in a resting state. When you wake up, blood pressure and circulation must increase to meet the brain's needs. In older adults, this transition can be uneven. Blood pressure may rise too slowly, too quickly, or fluctuate. These fluctuations can create a feeling of mental cloudiness or pressure in the head that improves later in the day. Head pressure without pain is often misunderstood. People expect serious problems to cause headaches, but pressure is different from pain. It can feel like fullness, heaviness, or tightness. This sensation can be related to changes in blood flow, fluid balance, or vascular tone rather than inflammation or injury. Because it does not hurt, it is rarely discussed. Sleep quality also plays a significant role. Many older adults experience fragmented sleep. They may wake frequently, sleep lightly, or spend less time in deep sleep. Even if total sleep time seems adequate, poor sleep quality can worsen brain fog by reducing the brain's ability to recover and regulate circulation efficiently. Poor sleep and circulation issues often reinforce each other. Medications can further complicate this picture. Drugs that affect blood pressure, heart rate, sleep, or mood can contribute to brain fog, especially when combined. This does not mean medications are wrong or harmful. It means their effects on the aging brain can be more noticeable. When brain fog appears or worsens after medication changes, it deserves attention. Brain fog should not be ignored if it interferes with daily functioning, decision-making, or safety. Difficulty concentrating while driving, managing finances, or following conversations can increase the risk of accidents and errors. Brain fog also becomes more concerning when it appears suddenly, worsens over time, or is accompanied by other symptoms, such as dizziness, weakness, vision changes, or irregular heart sensations. It is important to approach brain fog calmly. Feeling mentally slower does not automatically mean dementia or irreversible decline. Many causes of brain fog are reversible or manageable when identified early. Circulation issues, sleep problems, medication effects, dehydration, and metabolic imbalances can all contribute, and many can be improved with proper attention. One of the most reassuring aspects of brain fog is that it often improves when underlying patterns are addressed. Stabilizing blood pressure, improving morning routines, optimizing hydration, reviewing medications, and improving sleep quality can all lead to clearer thinking. Many people are surprised by how much mental clarity returns when these factors are addressed together. Ignoring brain fog allows gradual decline to continue unnoticed. Paying attention creates an opportunity for intervention, while changes are still subtle. After 60, maintaining mental clarity is essential not only for independence, but also for confidence and quality of life. Brain fog and head pressure are not symptoms to fear, but they are symptoms to respect. They are signals that the brain is asking for more stable support. Listening early allows you to respond thoughtfully, rather than react later to more serious problems. Many people feel uneasy after watching a video like this. Not because the information is scary, but because it makes them think about things they have been ignoring. That reaction is normal, and it is important to say this clearly and calmly before we finish. Experiencing one or more of these symptoms does not mean something terrible is about to happen. These symptoms are not verdicts. They are signals. And signals are valuable because they give you time. Most serious health problems after the age of 60 do not begin suddenly. They develop quietly, over months or years. The body almost always gives small signs first. The danger is not the symptom itself. The danger is dismissing the pattern. Morning dizziness, persistent fatigue, irregular heart sensations, shortness of breath with mild activity, and brain fog all share something in common. They are easy to explain away. They do not always hurt. They do not always stop daily life right away. That is why they are often ignored. But ignored signals do not disappear. They simply grow quieter until they grow louder. Paying attention early does not mean panic. It means awareness. Awareness allows you to adjust habits, review medications, improve routines, and seek guidance before problems become emergencies. Another important point to remember is this: aging itself is not a disease. Needing more time, more rest, or more careful pacing does not mean weakness. It means the body is changing, and adaptation is part of aging well. Many people believe that taking care of their health means doing more exercise, more supplements, more restrictions. In reality, after 60, health often improves when we do things more wisely, not more aggressively. Small changes matter. Slower mornings matter. Better hydration matters. Paying attention to patterns matters. These adjustments may seem simple, but when practiced consistently, they protect the heart, the brain, and overall independence. If you recognized yourself in one or more of these symptoms, let that recognition motivate calm action, not fear. Talk to your healthcare provider. Share patterns, not just single moments. Ask questions. Understanding your body is not complaining. It is participating in your own care. This channel exists for one purpose: to help you understand how aging really works, without confusion and without fear. Knowledge does not create anxiety. Uncertainty does. If this video was helpful, consider subscribing. New videos on this channel focus on heart health, blood pressure, circulation, and aging safely after 60. In the next video, we will talk about something that surprises many people: why normal blood pressure numbers can still be dangerous after 60, and what doctors actually look for beyond the numbers. Thank you for taking your health seriously. Small attention today protects years of health tomorrow.